Clostridium tetani. Tetanus, also known as lockjaw, is an infection characterized by muscle spasms. In the most common type, the spasms begin in the jaw and then progress to the rest of the body. These spasms usually last a few minutes each time and occur frequently for 3 to 4 weeks. Spasms may be so severe that bone fractures may occur. Other symptoms may include fever, sweating, headache, trouble swallowing, high blood pressure, and a fast heart rate. Onset of symptoms is typically 3 to 21 days following infection. It may take months to recover. About 10% of those infected die. Tetanus is caused by an infection with the bacterium Clostridium tetani, which is commonly found in soil, saliva, dust, and manure. The bacteria generally enter through a break in the skin such as a cut or puncture wound by a contaminated object. They produce toxins that interfere with muscle contractions, resulting in the typical symptoms. Diagnosis is based on the presenting signs and symptoms. The disease does not spread between people. Infection can be prevented by proper immunization with the tetanus vaccine. The wound should be cleaned and any dead tissue should be removed. In those who are infected, tetanus immunoglobulin, or if it is not available, intravenous immunoglobulin IVIG is used. Muscle relaxants may be used to control spasms. Mechanical ventilation may be required if a person's breathing is affected. Tetanus occurs in all parts of the world but is most frequent in hot and wet climates where the soil contains a lot of organic matter. In 2015 there were about 209,000 infections and about 59,000 deaths. This is down from 356,000 deaths in 1990. Description of the disease by Hippocrates exists from at least as far back as the 5th century BC. The cause of the disease was determined in 1884 by Antonio Carl and Giorgio Radone at the University of Turin, with the vaccine being developed in 1924. There are currently no blood tests for diagnosing tetanus. The diagnosis is based on the presentation of tetanus symptoms and does not depend upon isolation of the bacterium, which is recovered from the wound in only 30% of cases and can be isolated from patients without tetanus. Laboratory identification of C. tetani can be demonstrated only by production of tetanus specimen in mice. Having recently experienced head trauma may indicate cephalic tetanus if no other diagnosis has been made. The spatula test is a clinical test for tetanus that involves touching the posterior pharyngeal wall with a soft-tipped instrument and observing the effect. A positive test result is the involuntary contraction of the jaw biting down on the spatula, and a negative test result would normally be a gag reflex attempting to expel the foreign object. The American Journal of Tropical Medicine and Hygiene states that, in a patient research study, the spatula test had a high specificity 0 false positive test results and a high sensitivity 94% of infected patients produced a positive test. Unlike many infectious diseases, recovery from naturally acquired tetanus does not usually result in immunity to tetanus. This is due to the extreme potency of the tetanus spasmin toxin. Tetanus spasmin will likely be lethal before it will provoke an immune response. Tetanus can be prevented by vaccination with tetanus toxoid. The CDC recommends that adults receive a booster vaccine every 10 years. The booster may not prevent a potentially fatal case of tetanus from the current wound, however, as it can take up to 2 weeks for tetanus antibodies to form. For adults and children over 7, the TD vaccine tetanus and diphtheria or TDAP tetanus, diphtheria, and a cellular pertussis is commonly used. In children under the age of 7, the tetanus vaccine is often administered as a combined vaccine, DPTD-TAP vaccine, which also includes vaccines against diphtheria and pertussis. Mild cases of tetanus can be treated with tetanus immunoglobulin TIG, also called tetanus antibodies or tetanus antitoxin. It can be given as intravenous therapy or by intramuscular injection. Metronidazole IV for 10 days. Diazepam oral or IV. Severe cases will require admission to intensive care. In addition to the measures listed above for mild tetanus. Human tetanus immunoglobulin injected intrathecally increases clinical improvement from 4% to 35%. In order to survive a tetanus infection, the maintenance of an airway and proper nutrition are required. An intake of 3,500 to 4,000 calories and at least 150 grams of protein per day is often given in liquid form through a tube directly into the stomach. This high-caloric diet maintenance is required because of the increased metabolic strain, brought on by the increased muscle activity. Full recovery takes 4 to 6 weeks because the body must regenerate destroyed nerve axon terminals. Thanks for watching.